So we really wanted to look at once the public health emergency ended in 2023, the states across the country that have moved to disenroll or unwind their Medicaid rolls of people who were then deemed ineligible. So our report looks at the status of Medicaid unwinding in all 50 states and Washington, D.C., how many of our residents are being disenrolled for procedural reasons, along with information on which states have expanded Medicaid access as permitted by the Affordable Care Act. Our methodology here was to use each state's disenrollment status, Medicaid expansion status, and procedural disenrollment rate to determine a passing, incomplete, or failing grade. Our procedural disenrollment rate was calculated using the share of people disenrolled for procedural reasons as compared to the share disenrolled because they were deemed ineligible. And our scorecard also considers that the federal government has required several states to pause their disenrollment process because of excessive procedural disenrollment. So we've come up with passing, incomplete, and failing grades, in addition to grades of F+ and F-, where governors, if for F+, in the case of F+, governors have tried to proactively advocate for Medicaid expansion, but they're being blocked by the state legislature. So some examples of states that have been graded here: a passing score. We actually only have one state in the entire country that has a passing score, and it's Hawaii. They have a state procedural disenrollment rate of 86%. They began unwinding in June. They have adopted Medicaid expansion, and they voluntarily paused their procedural disenrollments so that they can work towards a comprehensive and accurate renewal process. For an example state that has been given an incomplete is Illinois. They have a procedural disenrollment rate at 16%. They also began unwinding in July. They have adopted Medicaid expansion, but they've been forced to pause disenrollments temporarily for at least some individual groups. And then one more example here, Wisconsin, which was given an F+. They have a state procedural disenrollment rate of 61%. Their unwinding began in July. They have not adopted Medicaid expansion, but Governor Evers has proactively advocated for expansion, but is being blocked by the state legislature. And they have been forced to pause disenrollments temporarily for at least some individual groups. So overall, we have one state, Hawaii, that is receiving a passing grade. We have 25 states with an incomplete grade and 15 states receiving a flat out F failing grade. We also have an additional 2 states that got an F+ and 8 states that have not expanded Medicaid got an F-. We have 28 states that have been forced to pause disenrollments by the federal government. And Hawaii is our, again, sole state that has voluntarily paused its unwinding process. The remainder are continuing disenrollments. We have access to our full scorecard, which I think folks will share with those of you on the call afterwards.
Thank you so much, Roshni, for your presentation. We'll now hear from the National Urban League's President and CEO, Mark Morial. Mark, you'll have the floor.
Yeah, thank you very much. And I appreciate the chance to share with everyone. Obviously, behind these numbers are people. Behind this disenrollment are children and families and mothers who are being dramatically impacted, because when you lose Medicaid, you lose health insurance. And the fundamental purpose of health insurance is to protect families from health and economic insecurity. Sometimes that economic security can mean bankruptcy as a result of the high cost of health care. It can create a situation where people who are ill or sick or dealing with chronic situations cannot access the health care they need to be able to get well. Impacted by this are expectant mothers who can lose access to prenatal care, people with chronic conditions, as I mentioned, like cancer or heart disease, children who may be dealing with long-term developmental harm. One or two unpaid medical bills can ruin one's credit, make home ownership more difficult, create a great deal of challenges in the family. It is why we are united in saying today that states should pause this so-called unwinding. Pause it, yes, especially for those who are being denied re-enrollment simply because of paperwork reasons, simply because of bureaucracy, simply because they don't dot an I, cross a T, miss a number, don't have a particular piece of information available to them. People in that situation should be given time to correct those, if you will, deficiencies in their paperwork, but maintain their health insurance while they do so. So this process has led to the largest Medicaid losses in American history. 1 million Americans, greater than the population of New York City. 10 million Americans. 7 million, that's 75% of those disenrolled, terminated because of nothing more than paperwork. So we stand united today. Thank our colleagues at the NAACP and others who collaborated on this project to put this information together. But we send our message to the governors of this nation: step in and do something. Thank you very much.
Mark, thank you so much for joining us. I know you had to head off, but we want to thank you for joining us. And I want to turn it over now to our good friend, Juliet Choi. Juliet, the floor is yours, my friend.
Great, thank you so much. As we know, Medicaid unwinding is one of the biggest health crises our nation has had to reckon with this year. And we'll continue to deal with this crisis going into 2024. As Mark stated, over 10 million of the most vulnerable families and children have lost coverage, and many, many more are losing their coverage. Failed leadership has brought us here. Governors have an absolute duty and responsibility to protect the well-being of their constituents, not some, but all their constituents, including communities of color, individuals with a disability, and immigrant families where language may be a barrier to navigating our complex healthcare system. The depth of this unwinding, the losses, varies by state dramatically to an extraordinary degree. The states with the highest level of Medicaid termination rates range from 30 upwards to 50%. And these states have refused to make the very nominal investments needed to operate a functional Medicaid system, the investment that could have averted this crisis. Stated another way, and as Mark underscored, we know that about 75% of individuals who've been terminated from Medicaid lost their coverage due to bureaucratic red tape. Hawaii, which has been highlighted as a state with the only passing grade, is showing the other states how to do it, how to mitigate against the unwinding. Investing in better systems means ensuring automatic renewal systems can keep as many eligible families on Medicaid. Outreach renewal is available in as many languages as possible, and call centers are well staffed and actually work. We've heard so many stories where folks will call centers and are on hold for hours with absolute no relief. I'm absolutely proud to stand with our fellow civil rights leaders here today. As we've stated, healthcare is absolutely a civil rights issue, and collectively we must continue to speak out on this absolutely unnecessary and avoidable crisis. All too often, communities of color and immigrant families are forced to shoulder the burden and consequences of these bureaucratic crises that they did not create. We need leadership from all 50 governors. We need our governors to double down, demonstrate that they have the political will to do the right thing, morally the right thing right now, to safeguard the health and well-being of millions of hardworking families and children. Thank you, and I'm looking forward to hearing from our wonderful civil rights leaders here. And again, we stand here shoulder to shoulder. Thank you.
Thank you so much, Juliet. Appreciate your leadership and work in this space. I want to turn over now to our colleague, my good friend, the Reverend Al Sharpton. Reverend Sharpton, your floor is open, sir. And Reverend, if you're speaking, you're on mute.
All right, thank you. Can you hear me now?
I can hear you.
All right, thank you, Sharon. And I'm very happy and challenged at the same time to join my colleagues leading national civil rights organizations. And certainly we stand with the NAACP led under the capable presidency of our brother Derek Johnson. This is not a just DC Beltway policy issue. We are in crisis. We have seen since April 1st, over 10 million individuals have been disenrolled or terminated from Medicaid, many based on, as Mark said, just paperwork or some red tape. It is devastating in communities of color because we're bearing the brunt of this unwinding, and it deepens an already serious problems of healthcare in our communities. It's estimated that 54% of people losing Medicaid come from communities of color. About 2.3 million Latinos, 1.8 million Black. It goes on and on. We already start from a position of weakness in terms of full health care in our communities, full health facilities. And now to add to this, the Medicaid crisis is something that is not only a civil rights issue, it is a human rights issue, which is why I think you have an unprecedented array of civil rights, national civil rights organizational leaders on this call. I was just at the White House meeting with Neera Tandem last Monday around the issues of state funding, how many state level hospitals are not even getting the funding because what was put through in 2009 under the Obama administration has been changed under Trump in 2016. So we're getting hit from all sides in terms of how we deal with healthcare in our community. We need to deal with this as an immediate issue. We need to press together and we need to fight this. Without our health, everything else is irrelevant. So I wanted to be on to say that Ebony Riley, who's our Senior Vice President of Policy, is going to remain on, because this is our night. We give away thousands of turkeys in Harlem for Thanksgiving. But I wanted to be on to give first my commitment to Derek and NAACP, the National Action Network, and our health unit Alicia Butler and others will be there for whatever we need to do. But we see this as something that is unbelievably offensive, that it has not gotten the attention that it should, and we're willing to do whatever is necessary to raise the profile on a crisis that has impacted our community disproportionately. Thank you.
Can you all hear me now? All right. Thank you so much, Rev. I appreciate you and the work on the ground. And you are speaking to an unconscionable experience that we're having in this country, where we're seeing paperwork stand in the way of people. And so for us, we are ecstatic about this partnership with all of us today. I want to turn over to our brother, Eric Rodriguez. Eric, the floor is yours, my friend.
Thank you, Siobhan, and it's a great privilege to be here with civil rights leaders to stand united. I want to thank the NAACP for the scorecard, which really puts and crystallizes what's happening across the states and where governors are failing. And there's no reason for that. This is unfair and this is unjust and a complete disaster to families who are being thrown off the Medicaid rolls. Governors have had time to plan for this. They've had resources from the federal government during the pandemic to get ready for this moment. And they have failed to live up to this moment and to serve families in the right ways. Latino communities, like others, are being disproportionately impacted. Most times they're finding out when they're going to the doctor and when they need health care that they don't have coverage any longer. And so it's no surprise that we've seen in the last few years healthcare rise up in the polls as important to our communities. And the number one issue is affordability. And now many families find themselves without the benefit of health insurance that helps to provide care to their affordable healthcare to their children as they work. And these are families that are hardworking, are part of the recovery, have done so much to lift up our economy. And for no other reason than missing paperwork, they're being thrown off of Medicaid, the sole source of their health insurance coverage. So it's no wonder we stand here united, calling on governors to do the right thing, invest in the hardworking people in your communities. Thank you.
Eric, thank you. Thank you for bringing up those issues. I'm excited about this discussion because what you all are seeing is not only the coordination between our organizations, but also the representation. And we're representing those communities that are really most impacted by this. I want to say I'm excited to hear from my good friend and colleague, Derek Johnson from the NAACP, who has been our leading team to help us with this process and this work. Derek, the floor is yours.
Thank you, Siobhan. And I want to thank all the partners who are joining in with us on this, because this is an important issue. The health of any nation should be gauged by three major components: how well we train and prepare our young people, how well we care for our elderly, and do we protect the right of the disadvantaged? And not having healthcare is a disadvantage. There's no reason why individuals should be knocked off the Medicaid rolls because of paperwork or bureaucracy. Our nation is better than that, or should be better than that. Our communities will suffer as a result of the governors and the state legislators not paying enough attention and having enough care for citizens. And so that's why this report card is important, to shine a spotlight on the states who have not done the due diligence to ensure that every individual who's qualified to be on Medicare actually have access to it. That's not too hard to ask for. So for the NAACP, we recognize this as a civil rights issue. For the NAACP, we recognize the need to partner with groups across communities. For the Black community specifically, we understand that how it impacts us also impact many other communities, and we must stand in solidarity. Whether you're working for whites, Latino, Asian, or whoever you are, as citizens, we should be entitled to a quality healthcare system, and paperwork should not be the thing that nullify one's access to healthcare. So I want to thank UNIDOS for launching a report last week. We're following it up with the report this week as we continue to work in communities across the country to ensure access to healthcare is afforded to every citizen who qualify for Medicare.
Derek, thank you for your remarks. And I just want to say, as someone who has been in the forefront of this work with you all for the last decade and a half, NAACP has been a force in this space and is excited about the work that is being done. I'm ecstatic to introduce my other colleague and sister friend, Sister Melanie Campbell, who is here. Melanie, the floor is yours. We want to hear from you to give us your perspective.
Thank you. I see you got the purple memo. I did. I got the purple memo. Thank you, Siobhan. I can remember all these years going back to when you were at the NAACP. It might have been when we first got a chance to really connect. So I know your passion and your leadership around this issue and others as it relates to our community. And of course, my brother Derek, just thank you for taking the lead on this, right? And really giving us an instrument to shine a light on this crisis, because that's what it is. The reality is healthcare should be a human right and not a privilege. And so the reality of the fact that states are failing when it comes to addressing this issue to make sure people have quality healthcare through this Medicaid unwinding. Many of these states are the same states that did not expand Medicaid in the first place over the last decade through the Affordable Care Act. And so, and many of these states are in the South. Many of these states where I'm from, and many of us are from, are in the South, where a majority of Black people live. And the reality is that it impacts people of color, Black people. It impacts our children, low wealth communities, those living under poverty. And it is a national crisis that we must address. The reality is, despite the efforts of the federal government to provide these opportunities, we have to hold these states accountable. There's always another election, and I know this is not an election conversation, but the reality is we need to be paying attention to that. But in the meantime, it's very important that states step up and just do what is right for the people that they profess to serve. Our children are depending on that. The reality is that not having access to quality healthcare means that it will affect their learning, the ability to have quality of life. We know Black women have high mortality rate, and when it comes to dying from childbirth and all of these things. And so we got the data. The question is, will these leaders who profess to be public servants step up and lead? So thank you again for this opportunity to join, and thanks for the press and everyone who put it all in to make this happen. Thank you, Siobhan.
Melanie, thank you. And, we've been at this a long time, and you really brought up a point that I want to highlight here, and that this is, for us, beyond politics. This is about human work that we do every single day. And when you think about the way that healthcare permeates everything that we do, healthcare is connected to education, to economics, to your ability to have quality access to care, to have health coverage, and even having a healthcare home. And I think one of the things that the civil rights leaders are really committed to in this moment is this call to action. You've heard the content, you've heard the backdrop, you've heard where the report is going, but now we need a call to action. I am so proud to have another great colleague and friend, Dr. Melissa Witt Glover, who is with the Council on Black Health. Many of us civil rights organizations have actually partnered with CBH to do an extensive amount of work on advocacy together. But Dr. Witt Glover, the floor is yours, and please give us our call.
Thank you so much. So we know these grades are disappointing, but we also know it's not surprising. The fact of the matter is the American healthcare system has long failed Black Americans. And so the council is proud to stand in solidarity with these partners, and we urge state leaders to engage in the collective dialogue that's critical for moving the needle on this issue. We know the power is in their hands, and the same processes that have been used to disenroll vulnerable Americans can be used to automatically re-enroll people who are eligible. We're not asking governors to reinvent the wheel. We're asking them to repair a broken system that is failing their constituents. And so what we're calling for is for all state governor and state Medicaid directors to do three things: pause all procedural Medicaid disenrollments, re-enroll those people, those eligible participants who have been wrongfully removed from the rolls starting on April 1st of 2023 to date, and then establish an accurate automated renewal system and a process moving forward to eliminate the high rates of procedural disenrollment. So that's our call to action.
Thank you so much, Dr. Melissa Witt Glover. You've heard the call to action. You've heard civil rights leaders aligned in this space. We now want to transition into our Q&A. We are right on schedule, so I'm so pleased to be able to give you time to go through this process with us. From my understanding, what we are asking all of you to do for our press who is on the line today, if you would not mind, in the chat, please drop your name, your outlet, and your question in the chat. Your name, your outlet, and your question, if you would place that in the chat, that will help us be able to go ahead and address your questions. Again, your name, your outlet, as long as your question in the chat so that we can go ahead and move forward with answering your questions. Your presence here from the press, we want to thank you because your presence makes a difference to have the word get out to our constituents across this country. Again, your name, your outlet, and your question. I'm going to ask the team to make sure they help me moderate this so that I don't miss any notes that are coming in. It looks like there was some disabled chat issues, so they're going to fix that, and we can open the floor as soon as that is fixed.
Yeah, the chat should be live now.
Thank you so much. There we are. The chat is now abled. It was disabled, and now it is abled. So if you do not mind going right ahead with your name, your outlet, and your question. And team, I don't know if there's anything in the Q&A function. I see it is also here as well. So any questions from the press? We do want to hear from you. We do want to make sure that we know what it is that you're thinking and what you would like to hear from us as we're looking at the next steps for this scorecard. All right, I see the first question coming in. The question is, should we give any states a pass based on their grade? Should any state get a pass? You might want to tackle that. Should any states be getting a pass? I mean, I can open up the part of that discussion and then the move forward. The answer for us is no. I think what we're clear on is when you say a pass is relative. If you are a state that is doing the work you're supposed to do, then the grading will be appropriate. But what we're saying is many states right now have not even looked into the issue. So what we're trying to do is call for all states to begin to make their assessments now, because what we see is that every day that passes by, this affects families, women and children, and those that are living with disabilities, persons who are unable to be able to access their care with this coverage. And so the answer is no, and the answer is, however, what we are looking for you to do is take action. We know that that is a process, but we know that we can have you call for an immediate assessment of your state's policies and processes. I know there are a couple of states that have started that work. There are a few states that have also received initially positive responses. There's some that are incomplete, but we know that we can see some changes with this policy and process, particularly with your paperwork. Any other questions? Okay. I'm getting some that are coming to me, so this is very helpful. This question is for Dr. Whit Glover. The question is for Dr. Whit Glover and for Derek. Why is there a focus on Medicaid? Why are we focusing on Medicaid?
I'm going to pass that to President Johnson.
Sure, my camera's off for some reason. We focus on Medicaid because what we have found in the research is that people are being removed from the role because of a procedural glitch or intentionality. Individuals who are qualified to be on Medicaid, who currently was on it, but now we're finding that they have been removed from the Medicaid's role because of paperwork. That's a tragedy. That's individuals who rely on access to health care only to find out because of paperwork they may not have health care. And it was disproportionately in the communities of colors, Blacks, Latinos, Asians, and others. And so we need to focus on this to highlight that states should be doing more. They depend on federal dollars to support their healthcare infrastructure. They should deliver healthcare, quality healthcare to citizens who are qualified to receive it. Siobhan, I think you on mute and my camera's off.
Yeah, we're having some tech fun here on Zoom. Thank you, President Johnson. I have another question that came in. Question number 3 that has come in. I see. If 50% of school-age children in public schools are on Medicaid, then what should schools be doing to address this fight? I'll say it again. If 50% of school-age children in public schools are on Medicaid, what should schools be doing as it relates to this fight? You might want to take that on. I want to take that with schools.
I think it's an obligation for schools to ensure that children are safe and healthy. And if you have young people who are lacking in access to health care, this is a role they should take on. Children learn best when they're healthy, when they're vibrant, and they have the opportunity to receive health care. And so it is important for schools, particularly schools in low poverty areas, to have due diligence in ensuring that young people are not only healthy outside of the school place, but in the school building by making sure they have access to health care.
And I think I'll add to that too, Derek. I think one of the intricate parts of schools and interesting spaces around schools is that our school health services are a major part of this work. So school nurses, folks that are serving in healthcare in schools can be a part of this conversation. Quite frankly, schools can also advocate. That's the word we've not talked about in this space. Schools can be advocates, especially teachers and school health officials, school board members can begin to talk about the way that children who are covered under Medicaid, the kind of services and support they need, and when they are not covered with health care, then there are long-term challenges. So I do not want to miss the opportunity to talk about how schools are also advocates. Your opportunity to stand in front of your legislative leaders makes a huge difference. And schools are a product of the states. So state departments of education should be aware of this issue as well. So there is an opportunity on both ends.
And I just want to jump in when you mentioned schools advocating. I think schools can also help to advocate to optimize the processes, just like school enrollment. So when we're talking about how to get students enrolled, schools can help to optimize the processes. And we know that 50% of the children in our schools are CHIP beneficiaries. So we are failing our children, especially our Black and Brown children, by not taking action. So we have to do something. And I think schools can be an important part of that.
Yeah.
Siobhan, Derek, and Melissa. Yeah, I absolutely agree. I mean, I want to go back to the governors and teachers and the education agency. School administrators have such a critical role. If you're not already, from an education perspective, if you're not already engaged with your governor and the governor's cabinet secretaries, just underscoring what Derek and Siobhan have stated, we absolutely want schools to be engaged in the advocacy. Number 2, with the procedural terminations, some of the red tape is as simple as somebody didn't get a letter, didn't have a chance to respond, and as a result, that family, including the children, are completely disenrolled from Medicaid. So we know our schools do a lot, but I think at the local school level, if you can host information sessions or clinics and the reminders of make sure to check your mail, have you received any information about Medicaid? If you're not sure, let's double check. I think schools can also help to host these information clinics because it is such a friendly environment. And several of us have stated this and will continue to state this. This is an all hands on deck exercise. So schools, places of worship, I know hospitals are getting involved as well. We need to continue to double down and reaching out to our families to ask them, do they have the information they need? Do they have the support to navigate the re-enrollment and termination processes that are unfolding right now?
Thank you so much, team. This was amazing. Those answers were really helpful, and I hope that the schools team is making sense to all that are on the line. I want to highlight from the Washington Post, Akila Johnson's question: how has this issue intersected with long COVID? Have you seen disenrollment or unwinding impact people's ability to receive care for long COVID? Let me take that on first, Derek, if you don't mind. Let me just say this: the unwinding impacts not just one specific disease. Unwinding affects not only disease treatment, but services as well. There are services that are covered. So long COVID is one of many issues that Medicaid patients have been dealing with. And I think that, you know, the question that you're asking is pertinent, because this idea of long COVID really connects to how pandemic-like experiences for a country, when you deal with disease for a long period of time, when it became a pandemic, we saw that there were other issues that were at risk for our patients. And then when you look at receiving care for long COVID, we're looking at receiving care for long COVID, receiving care for diabetes, for insulin, for persons that had cancer. So there is a connection to not just long COVID, but overall chronic disease support and treatment that many patients are recovering from. So I want to start there. Derek, any thoughts on that? I see others that are coming off mute as well.
So for many individuals who are healthcare professionals, they long talked about comorbidities. For those of us, when we walked into the COVID reality, we began to really understand what that truly meant. But I want to expand that meaning to a comorbidity is lack of access to healthcare because of not having Medicaid. You think about, as a result of COVID, over 22 million people finally received healthcare. And now we're watching those individuals roll off the rolls because of technicalities. That is a sad state of where we are as a nation. That's a sad state of where we are as individual jurisdictions. Simply are lacking the type of concern for human life. Individuals need access to health care like individuals need water. It should be not only a civil right, it should be something that we all expect at a level and quality that could guarantee a quality of life that we want our kids to have, our parents to have, that we should enjoy.
Thank you for that, Derek. Any other questions from the press? Any other questions from the press before we bid you all a great afternoon? Okay. Listen, I want to thank you all for joining us this afternoon. I want to thank our colleagues and congratulate our friends at the NAACP and all of us that work together. We are pushing this pause through 2024. I want to say that again. We're going to be pushing the pause through 2024. For those that attended RSVP, you will get a copy of this press release. It shall be released tomorrow morning. It's going to include a recording of this call as well as a link to the scorecard, which will be available on naacp.org. On behalf of our civil rights leaders, I'm Siobhan Arline Bradley, President and CEO of NCNW. Proud day for us today to collaborate and work on this. You all have a wonderful afternoon and continue pushing to press the pause. Have a wonderful day, everyone.